On average, one suicide occurs every 16 minutes. If you, or someone you know, is considering suicide, or has made plans to do so, you should seek immediate help. Please contact a mental health professional, or call 911 now, and don't become a statistic.
The 1997 Mental Health Report of the Surgeon General gives us an astounding comparison. Major depression is equivalent in burden to blindness or paraplegia.
Depression affects approximately 20.9 million Americans, or 9.5% of the population, in any given one-year period. At some point in their lives, 10 to 25% of women and 5 to 12% of men will likely become clinically depressed.
According to the World Health Organization, major depressive disorder is by itself the leading cause of disability among Americans aged 15 to 44.
Depression not only causes suffering to those who are depressed, but it also causes great difficulty for their family and friends who often don't know how to help. Clinical depression is more than just the blues, or experiencing temporary feelings of sadness that most people experience from time to time. Depression impacts all aspects of everyday life, including eating, sleeping, working, relationships, and how a person thinks about themselves. People who are clinically depressed cannot simply will themselves to feel better. Despite the availability of effective depression treatments, only about 1/3 of those who are depressed actually receive treatment. Many people do not seek treatment for depression for a variety of reasons. Some believe that depression is the result of a personal weakness, or a character flaw. Others simply do not recognize the signs or symptoms of depression, although they may suspect that something is not quite right with them. And many are intimidated by the stigma associated with receiving mental health treatment. The 1997 Surgeon General's report states, "Mental disorders are not the result of moral failings or limited willpower, but are legitimate illnesses that are responsive to specific treatments." One would do themselves a favor to seek treatment as soon as they identify symptoms of depression, since they could feel better within weeks of beginning a treatment plan.
Is this depression, or just the blues?
Sooner or later, everybody gets the blues. Feelings of sadness, loneliness or grief, when you go through difficult life experiences, is all part of being human. Most of the time, you can continue to function. You know that with time, you'll bounce back, and you do. But what if you don't bounce back? What if your sadness lingers, is excessive, or interferes with your sleep, work, relationships, or even recreation? What if fatigue, or feelings of worthlessness, or unintended weight changes, accompany your sadness? This can indicate clinical depression.
How do I recognize depression?
Here are the most common symptoms associated with depression. Keep in mind that one may not experience all of these symptoms. Sadness, anxiety, empty feelings, or appearing sad or tearful to others. Decreased energy, fatigue, or a feeling of being slowed down. Loss of interest or pleasure in activities you once enjoyed. Insomnia, oversleeping, or waking much earlier than usual. Loss of appetite, overeating, weight gain, or significant weight loss when not dieting. For instance, more than 5% of your body weight in a month. Feelings of hopelessness and pessimism. Feelings of helplessness, guilt, and worthlessness. Thoughts of doom, death or suicide plans or attempts. Difficulty concentrating, making decisions, memory problems or other cognitive difficulties. restlessness, irritability or excessive crying. And chronic, unexplained aches and pains, or physical problems that do not respond to treatment.
What are possible causes of depression?
It is generally believed that clinical depression is most often caused by the influence of more than one or two factors, including someone whose parent had recurrent major depression may have a predisposition to developing clinical depression as well, combined with how the person thinks about themselves in response to stress, may put them at a greater risk for developing depression than someone else who does not have such influences. The causes of clinical depression are most likely to be different for each person. Sometimes, a depressive episode can appear to come out of the blue when everything seems to be going fine. Other times, depression may be directly related to a significant event in our lives, such as losing a loved one, loss of employment, experiencing trauma, or battling a chronic illness. Studies have even linked other illnesses to depression, including diabetes, heart disease, osteoporosis, eye disease, back pain, and some forms of cancer.
What are the risk factors for depression?
Essentially, we are all at risk for developing a depressive illness. People of all ages, races, and social classes can become clinically depressed. However, nobody is predestined to develop clinical depression. It is important to be aware of the risk factors so that those of us who are vulnerable can become better informed, be attentive to warning signs, and prevent a worsening of symptoms. The risk factors for depression include marital status. Women who are unhappily married, divorced, or separated have high rates of major depression. Men who experience divorce have a higher risk of depression. The rates are lower for those who are happily married. Your age. While clinical depression usually occurs for the first time when a person is between the ages of 20 and 50, people over the age of 65 are especially vulnerable. Previous episodes. If you've had major depression once before, your chances of developing it again increase. According to some estimates, approximately 1/2 of those who had depression will experience it again. Genetic factors. People who have relatives who've had clinical depression have a greater chance of developing it themselves. Also, having a close relative with bipolar disorder may increase a person's chances of developing major depression. Your gender. Women are about twice as likely as men to be diagnosed and treated for major depression. Approximately 20 to 25% of women and 12% of men will experience a serious depression at least once in their lifetimes. Among children, depression appears to occur in equal numbers of boys and girls until adolescence, when girls begin to move into the women's percentile.
Should I seek treatment for depression?
If you have 5 or more symptoms for most of the day, nearly every day for at least 2 weeks, and the symptoms are severe enough to interfere with your daily activities, you may have major depression. It's important to speak to your doctor about treatments to start helping you feel better. We encourage you to seek help when concerns arise about your emotional health, just as you would if it were your physical health in question. Please, contact us if you have questions about treatment, or if you need support.
We hope you enjoyed this presentation. Please look for our other information videos.
For more information, visit us on the World Wide Web. Chronic pain and depression. www.pain-and-depression.com